Thanks for having me. That's indeed a very good question. So within the purview of the work of our committee in advising the provincial government, we certainly have a bunch of tasks. One of them is to provide the best possible advice based on analytics, including artificial intelligence, in view of the complexity of managing a pandemic of the magnitude of the one we have right now. So we have three main pillars, three things that we have to understand and model and use in order to help our healthcare system deal with the pandemic. The first, of course, is non-pharmaceutical interventions. And their efficacy that we have to continuously monitor and understand and model. Unfortunately, this will have to continue even when the first vaccines come in, because we still have a lot of people that can get infected, and non-pharmaceutical interventions will remain a very important pillar of our strategy.
Yeah.
The second is the understanding and the deep understanding of herd immunity, or as the president calls it, the population immunity, because we know as more and more people get infected, we approach herd immunity, and we have to constantly monitor this phenomenon. In particular, we have to pay a very close look at the people that get reinfected or that display symptomatic infections twice, in particular, if those are correlated with the virus. This is another very important aspect. But the third, as you already indicated, here is the fact that we're going to have a limited number of vaccines, a limited number of vaccination as a function of time, and we have to provide the most effective strategy of that rollout in order to maximize the effect of a small number or relatively small number of vaccines at first as the process of vaccination rolls out.
Yeah, let's deal with one of the points you've raised, Prof, and that is that of vaccinating a good number of the population in order to achieve what you say there, which was said by the president, and that is that of population immunity. Importantly, though, is that 40 million South Africans, that's the ambitious target. 40 million South Africans are going to have to be vaccinated for the country to achieve this population immunity. First and foremost, is that achievable, or is it too ambitious a goal?
In principle, that's achievable over a period of time. It's certainly very challenging if you want to think about doing that in a short amount of time. And every country in the world is actually struggling with that. So what we are faced with is, as already indicated by the Department of Health and Minister Mkhize, is a staged approach to the vaccination. So first, of course, and foremost, we have to protect the integrity of our healthcare workers. We have to protect the integrity of our healthcare system. Those are our frontline workers, so to say, and they need to be protected. Then, of course, comes a phase where we will start vaccinating other sectors of the population that may be more likely to contract the virus or are likely to contract severe illness. And that's where smart algorithms based on artificial intelligence come in. Why? Because the probability of someone to contract the virus and the probability of someone to acquire severe illness, hospitalization, or unfortunately mortality is the result of many factors. It's a very complex problem. So that's where artificial intelligence come in, and it comes in because of two main reasons. One is the fact that you have many factors that contribute to that outcome. It's not just age. There's a lot more that happens underneath that basically provides a higher risk of someone to acquire severe illness. But also
Very
the fact
briefly,
that because
Prof.
it's such a complicated...
I'm sorry to interrupt you there. Very briefly for me, let me be more precise. 40 million South Africans need to be vaccinated in order to achieve this herd immunity. But is that achievable by the end of this year?
Okay, in order to arrive at such a concrete estimate, we need to understand the exact capabilities of vaccination. As we know, for experience from other countries and experience in South Africa itself, talking to experts, the rolling out of a very large number of vaccines represents a challenge in itself. So I can't really,
Morning,
at the
Council.
moment, without knowing the capabilities of the province to that level of accuracy, I can't
Council.
really give you an answer. I mean, I think it's probably possible, but we need to know the details. The devil is always in the detail, okay?
Yeah.
Because rolling out a large number of vaccines to a large number of people is a challenging one. However, what we have to always bear in mind is that this will be done in a phased way, and we have to do it in the most optimal way that maximizes the reduction of severe illness and mortality.
Yeah.
That will be the key in the rolling out of this vaccine.
And part of that smart vaccination strategy you talk about, Professor Milado, you also mentioned that this intervention will need to go to areas where the most susceptible people are. And luckily, I talked to a person who advises the Gauteng government, a province that has, I think, most of its metro areas declared hotspots. Is that where this ought to start, the smart vaccination strategy? Townships, are they going to be the immediate target, or is that not really going to be the strategy for government?
So our advice as a committee will be to provide the most effective algorithm to reduce severe illness and mortality. So what we are devising now is an integrated algorithm that takes into account all the risks that can lead to severe illness, probability of exposure, age, gender sometimes plays a role, as we have seen, comorbidities, social vulnerabilities, and all those things will be folded into this integrated algorithm. So indeed, areas where there is a higher risk of fatal outcomes will, of course, have to be attended to first. And it will be an objective algorithm that will be able to tell us with actual numbers, not just, so to say, guesses, but actual numbers of what is actually going to be the most effective way to reduce mortality.
Yeah. Professor Bruce Milado, let's leave it there. Unfortunately, because of time, I would have wanted to ask you about the variants, over 20 of them now, that exist of this virus globally, and whether this is going to be an issue when it comes to vaccines. Are they going to, or are vaccines going to be able to withstand them? But we'll continue the conversation, I'm sure. The COVID-19 is an ongoing story. So, but thank you for the time being, Professor Bruce Milado, also an advisor to the Gauteng Coronavirus Command Council.